Good afternoon, everyone. On behalf of our Board of Directors, welcome and thank you for tuning in for Gift of Life's exclusive Orange Society event. This virtual experience is presented in conjunction with One Huge Day, our 24-hour campaign to raise funds to support Gift of Life's mission. Today, we have a very generous matching gift donor and an opportunity to raise $200,000 for Gift of Life. We can't do this without you. And I'm very excited to watch the thermometer rise today as we inch closer and closer to our goal. It is now my privilege to turn it over to our host, Gift of Life's founder and CEO, Jay Feinberg.
Thank you, Steve. I'm looking forward to seeing that thermometer rise too. And welcome, everybody. I'm very excited about today's program. And that's because we'll hear from Julie Rubinstein, President of Adaptive Biotechnologies, who will speak on pioneering the age of immune medicine, a topic that couldn't be more timely as we continue to battle the coronavirus. Following her talk, Julie will field questions live, so please be sure to use the chat box to submit your questions. But before we hear from Julie, I'd like to introduce our good friend, Dina Fantel, who is joining us all the way from Seattle, Washington. Dina received her bone marrow transplant from Gift of Life in 2013. She's a good friend and one of Gift of Life's most dedicated supporters. Hi, Dina, welcome.
Thank you, Jay. I want to start by wishing you a very happy 25th transplant anniversary. Your tireless and visionary work has saved thousands of lives, including mine. As Jay mentioned, I'm a bone marrow transplant recipient. My life was saved almost 8 years ago, thanks to Gift of Life and my wonderful donor, Ethan. Everyone at Gift of Life is so passionate about and dedicated to the mission of helping all patients in need of life-saving transplants. And this is only possible thanks to wonderful supporters like you. I am living proof that your contributions truly do help save lives. I was able to meet Ethan, my hero, for the first time at a Gift of Life gala in New York, and it was truly an amazing experience. I'm beyond grateful for the gift that I received, and so impressed with the incredible work Gift of Life does for patients every day. And this is why I am committed to helping Gift of Life in any way I can to help ensure others receive the same miracle that I did. I'm also really grateful to Ethan's family for so generously participating in today's matching grant for One Huge Day. As Steve said earlier, up to $100,000 will be matched dollar for dollar today, making your contribution go even further. All funds raised today go directly towards adding new donors to the registry. This will help Gift of Life find matches for patients still searching for their donors and give a second chance of life to so many in need. So let's all come together today and save as many lives as we can. Let's make this year's One Huge Day the largest yet. Thank you so much for your generosity and support. Gift of Life is currently working with 3 patient families in urgent need of a match for their loved ones. One of those patients is a sweet 3.5-year-old girl named Sloan. I'm happy to introduce Sloan and her wonderful family with a special message now.
Hi everyone, and thank you so much for joining us for One Huge Day. Sloan and Mackenzie are our twin daughters and they're best of friends. They're so amazing and most precious to us. Sloan has been battling 2 types of cancer and is in desperate need of a bone marrow transplant. Unfortunately, no one in our family is close enough matched to donate for her, and neither are any of the thousands of volunteer donors on the registry. We're in urgent need of a match for Sloan and have been doing everything we can to spread the word. Your support today will allow us to add more donors to Gift of Life's registry and increase the chances of finding our daughter's perfect match. With your contribution, we can save not only Sloan's life, but the lives of so many others who are searching. Gift of Life is such an amazing organization and has been so incredible to our family. We're so grateful to you for supporting this fabulous organization. Today is the day. Your contributions will be matched dollar for dollar, and you have no idea how much it would mean to us and to Sloan if you would consider helping us find her miracle donor. Please donate today. Thank you.
Thank you.
Oh my gosh. Thank you, Sloan. You and Mackenzie are adorable, and we appreciate your very important message today. And we're here for you, and we send all our love. And thank you, Dina, for showing us the impact each and every donor has on so many lives. We're grateful to you and for all you have done to support Gift of Life, and we truly appreciate the Lax family's incredible generosity contributing to today's matching gift. Before I continue, I would like to take a moment to recognize that the past 9 months have not been easy for any of us out there. The pandemic has affected every aspect of our lives, and our work at Gift of Life has been no exception. But our incredible staff has risen to the challenge because cancer doesn't stop for COVID or anything else. And I'm proud to say that they haven't missed a beat. In fact, we have facilitated more transplants this year than any other year in our history. My sincere thanks to our heroic stem cell donors for stepping up to pay it forward despite the stress and anxiety of doing it during a global pandemic. And my thanks to you, our constituents, for standing by us, continuing your support despite uncertain economic times. Despite it all, everything that's been going on, I'm thrilled to announce that last month, Gift of Life celebrated an historic achievement with the grand opening of our new Center for Cell and Gene Therapy. This new facility represents the culmination of a dream, and it's a natural extension of Gift of Life's mission to save lives. A pioneering service of this new center will be a biobank of cells from Gift of Life registry donors available on demand for transplantation, engineering for cell and gene therapies, and ethical research, fulfilling our goals to advance treatments that save lives and improve outcomes. And by the way, wearing my fundraising hat now, there's a naming opportunity available for the new center. So if you happen to know anybody who might be interested, please, I hope you'll send them my way. Our commitment to providing every patient with an equal opportunity to benefit from the treatment that can save their lives has never been greater than it is now. And this brings us to our keynote speaker for today, Dr. Julie Rubinstein. Julie is president of Adaptive Biotechnologies, which aims to translate the genetics of the adaptive immune system into clinical products to diagnose and treat disease. Julie joins us today to discuss advances in immune medicine, as well as some insights into the immune response to COVID-19. She will be taking questions at the conclusion of her remarks, so please enter them into the chat box on the screen, and we'll take as many questions as time allows. And now, I am thrilled to welcome Julie Rubinstein.
Good afternoon, everyone. My name is Julie Rubinstein, and I am a proud supporter of the Gift of Life and also the president of a company called Adaptive Biotechnologies. It's an honor to speak before all of you today. The Gift of Life has actually been a part of my family, literally, for the past 18 years, and is why my dad, Dr. Michael Steinberg, a 3-time transplant survivor, is here with us today. When I was pregnant with my now 18-year-old daughter, Emily, my dad was diagnosed with a rare bone marrow disorder called myelofibrosis. Ironically, he had donated blood at our temple in Livingston, New Jersey to support the bone marrow drive for Jay, even before the Gift of Life was created, and long before my dad's own diagnosis. Like most people, you never know when you're actually going to need such a gift. His first 2 donors, Ben and Bruce, were both from the Gift of Life, and each one gave my dad a few years of time. By the time he needed his 3rd transplant, the research had evolved to the point where family members could be donors for their loved ones, and I actually became his 3rd donor. Today, 18 years after his diagnosis, exactly 5 years after his 3rd transplant, and 1 day after his 78th birthday, happy birthday, Dad, he's cured. In fact, thanks to this amazing organization, my dad might be one of the only living adults in the United States who has had 3 successful bone marrow transplants. He's also had 18 years that he never expected, 7 grandkids he's watched grow up, taught to ski, and unfortunately for them, given most of them braces. And he and my mom have built long-lasting relationships with his two first donors, thanks to the incredible connections forged by the gift of life between donors and recipients. In fact, my dad and Ben gave a talk together at a Gift of Life event in Israel a few years ago, and his second donor, Bruce, sent in a video clip. Today, my daughter, who was a newborn when we first started this journey, is also involved in the Gift of Life and wrote a song in my dad's honor that won her this summer's talent show. You can come see her perform at the Gift of Life Gala at Cipriani next fall, I think rescheduled from May to September because of COVID. And as a proud mom, I can tell you that it's worth coming to hear her perform. So that's my personal connection to the Gift of Life, a full circle, as my dad calls it. On a professional level, the work we do at Adaptive Biotechnologies has many synergies to the Gift of Life, which is why Jay so graciously invited me to speak here today to share with you some of our recent work and progress. Adaptive Biotechnologies was founded in 2019 at the Fred Hutchinson Cancer Research Center on the promise that the answers to so many diseases actually lie within us in the genetic language of our adaptive immune systems. Throughout the whole journey with my dad, seeing firsthand that we could save lives by looking within ourselves, I was working with Adaptive to do something very similar, to build a technology platform to decode how our adaptive immune system naturally detects and fights disease. For hundreds of millions of years, the body's immune system has been evolving to better protect us and keep us healthy. It's a force inside your body so powerful that most of the time it's able to detect and fight any disease that you come into contact with, often before you even realize that you're sick. Our body's capability is nothing short of amazing. At Adaptive, we believe that we have a great opportunity to harness this capability to power a new era of medicine, which we call immune medicine, to detect and treat disease by learning from the way the body's immune system does it naturally. Like the Gift of Life, many of the clinical products that we have developed using our technology are actually for cancer patients. First, we have an FDA-cleared test called clonoSEQ that's used to monitor relapse, or what's called minimal residual disease, in patients with certain leukemias and lymphomas. We use our immune medicine platform to do this because in these types of blood cancers, the cancerous cell is actually a key cell of the immune system, either a T cell or a B cell, which is why you often hear of TALL or BALL, for example. It's either T cell mediated or B cell mediated. With clonoSEQ, we're able to identify the remaining blood cancer cells that can stay in the body during and after treatment or transplant, and may be a sign that the cancer is returning. The science of clonoSEQ is so advanced that it can detect one single cancer cell among 1 million healthy cells. To date, clonoSEQ has helped over 14,000 patients in the United States, and it's now being used in hundreds of cancer centers to help clinicians look for relapse as early as possible and make critical next step decisions for each and every one of their patients. We're also working in partnership with a biopharmaceutical company that many of you might be familiar with called Genentech to leverage our immune medicine platform to identify T cell receptors, which are the first responders of your adaptive immune system to recognize cancer, that can be engineered into cellular therapies for cancer patients. Again, this is another area of great overlap with the Gift of Life's new Center for Cell and Gene Therapy. With Genentech, we are also making off-the-shelf products, as well as products that are personalized for each patient's unique cancer. The progress has been amazing, and Genentech will be bringing our first product to the FDA early next year. But remember, our focus is on the immune system and not on any one particular disease. Our ultimate goal is to understand how the immune system fights all diseases so we can develop solutions for many different kinds of patients. How do we do this? Well, we actually embarked about 2.5 years ago on an enormous undertaking with Microsoft to build a map of billions of immune cells in our adaptive immune system to signals of disease, which we call antigens, that they bind to. With this map of T cell receptors and antigens, we can develop new diagnostics from a simple blood test that can reveal which diseases a patient's immune system has seen or is actively fighting. Specifically, we're focused on mapping T cells to antigens of disease, since the T cells are the first cells of the adaptive immune system to see anything foreign in your body, whether it's a pathogen, a virus, a bacteria, or cancer. It's the T cells that see it and initiate the rest of the immune response. Even if you've never talked about it before, I would bet that most of you have been hearing about, talking about, thinking about your immune systems more than ever before, given the COVID-19 pandemic this year. And even hearing about T cells in mainstream media, which is something that we've never really seen in the past. COVID-19 has really catapulted researchers and society's understanding and appreciation for the critical role that the immune system plays against disease. It's literally become a matter of life and death, depending on how your immune system reacts to the SARS-CoV-2 virus that causes COVID-19. When the pandemic struck, we knew that our platform in partnership with Microsoft could be immediately used to decode the T cell response to COVID-19 and uncover the specific T cell receptors that indicate exposure to the virus. At record speed, just over a few months, we've analyzed the T cell response from nearly 5,000 COVID-19 patients from 7 countries to generate the largest database of T cell response to any disease ever mapped. And we call this the ImmuneCODE database. To date, we've mapped hundreds of thousands of T cells to all of the genes of the SARS-CoV-2 virus that the immune system sees. And we've made all of this data freely available to researchers around the world to try to expedite anything they're working on to drive solutions to the pandemic. Through this work, we were also able to identify a smaller set of T cell receptors that are actually shared among COVID-19 patients. From this, we've created the first T cell test for consumers to detect specific T cells that can confirm recent or past infection from the COVID-19 virus. This new test, called T-Detect COVID, is the first T cell test to confirm past infection to COVID-19, and it performs better than the majority of the antibody tests in real-world studies that we've been able to compare to. And we've used this information to support a launch of this product, in fact, just this past Monday. So it's been a pretty busy week at Adaptive. It's now available at tdetect.com, and we'll be filing for FDA clearance before the end of this year. As you may be aware, there are so many questions that we and the rest of the world are waiting to see if T cells can help answer. We still don't have all of the answers, but here are some of the questions we're trying to provide insights into. How long does immunity to the virus last? And now, with all the exciting news with vaccines, how long does immunity to the vaccine last? We actually don't know that yet. Why do some patients end up in the hospital fighting for their life and others merely get a cold, and about 40% are actually asymptomatic? And since T cells seem to be persisting longer than antibodies, will we need to measure our T cells on a regular basis in the future? These are all important questions that we and our peers in the scientific community have been working day and night to answer, and we're confident that in time, the immune system will tell us everything that we need to know to understand this virus and other future pandemics that we may face. Just like the gift of life, the success of this research would not have been possible without COVID-19 patients willing to give their blood samples to help us uncover the clues that their immune systems hold. Every person gets us closer to answering these critical questions. So what's next? While COVID-19 is an immediate threat to all of us, we're working to make sure the immune system becomes accessible to fight all kinds of diseases, including cancer. We're working on Lyme disease, Crohn's disease, rheumatoid arthritis, multiple sclerosis, and other autoimmune conditions. Just like the stories behind each gift of life donor are unique, so too are the stories behind every immune system. By decoding these stories, we can create better endings for more people battling disease from COVID-19 and cancer and beyond. What is abundantly clear across both of our organizations is that the power of the human body to fight disease is nothing short of extraordinary. And as important is the power of those who give to science, whether you are a patient, a survivor, a donor, a caregiver, a researcher, a financial supporter, or an advocate, we are powerless without you. This changes lives and will change the future. As I close and pass it off to Jay, I will remind you that from its beginnings nearly 30 years ago, the Gift of Life now has close to 400,000 donors that could be the cure for a person just like my dad. It only takes one. I'm thrilled to hear that the Gift of Life will soon be offering its donors the opportunity to participate in the advancement of cell and gene therapies. And I was so excited to see the grand opening of the Gift of Life's new Center for Cell and Gene Therapy that you all just had the opportunity to see a little bit of as well. The innovation here at the Gift of Life is groundbreaking. Thank you again for having me and supporting the Gift of Life, and enjoy the rest of your day.
Thank you, Julie. That was wonderful. Really, really appreciate it. And as you can imagine, there's a couple of questions for you as we open up the question and answer part of our talk here. So, for this first one, and possibly for a few, you're going to have to wear the hat of Dr. Anthony Fauci.
Right. We'll see.
Right. So, first question, what are your thoughts on the new COVID-19 vaccines that recently rolled out? And are you confident that they are safe and will work? How soon do you think we will be able to get back to normal pre-pandemic life?
Sure. So I will say that I came from Pfizer, actually. I spent almost a decade at Pfizer, and I believe very much in the science that goes on at that great organization. And we also know many of the people behind the other vaccines, as well as most of these large pharmaceutical companies are partners of Adaptive. So I feel really confident in the vaccines that have been developed. I believe there was great science. I know a lot of the people personally who have worked around the clock over the last couple of months to make this possible. I think it's remarkable that they've been able to do so. I do think there's still questions, of course, that they too are trying to answer, like some of the ones I mentioned. You know, how long will immunity last to the vaccines? Will it work in all people? You know, those are still some questions that we're still all working to answer, and they'll be answered over time. But I will absolutely get my vaccine. I just don't think I'm anywhere near the front of the line. So, you know, I hope that the majority of our country will be vaccinated by the summer, if not sooner. And I hope the majority of the country will take the vaccine. I think it's going to be really important for us to be able to get back to a more normal pre-pandemic life.
So just like you're playing Anthony Fauci, I'm going to play Wolf Blitzer. So will you take the vaccine when it's offered?
Will I?
Yes.
I definitely will take the vaccine when it's offered.
Okay. All right. Wonderful. So when do you think we'll be able to get back to that normal pre-pandemic life? And will there be, you know, will there be the same normality that we had before going forward?
So I think that things are going to change a little bit, because COVID, just like the flu, I think is going to become endemic in our population. I mean, right now it's a pandemic. We don't have herd immunity. You know, we're certainly not living a normal life. And even with vaccines, there's going to be portions of the population that will refuse the vaccine. There'll be people who can't take the vaccine for a variety of reasons. And even with the vaccine in the real world, where we're not all living at home, the efficacy rate, while it's going to be great, it's unlikely to be 95% when people are out and about and living in the world again. And so there's still going to be people who contract COVID-19. So I think for a while, I wouldn't be surprised if people start wearing masks on airplanes, you know, live slightly differently than we did in the pre-pandemic state. And I do still believe there's going to need to be continued research for therapies for patients who do contract COVID-19, because we still don't understand the differences between those who are asymptomatic and those who become incredibly ill beyond the pre-existing conditions that some people have. We at Adaptive are also working on neutralizing antibodies. Others are working on neutralizing antibodies, and there continues to be a lot of research for new therapeutic solutions, which I do believe we'll still need, even in a post-vaccine world.
Okay. So, it's been about 100 years since we've experienced anything like this, not in any of our lifetimes. Do you think it's going to be another 100 years, or do you think we're going to be seeing more and more situations like this?
So I don't have any reason to believe there's not like we have any clues or anything, but I can tell you that the scientific community believes it's going to be less than 100 years just because of the pace of laboratory research, and just the way that our societies have evolved. So we are all actually preparing now to get ahead of the game for the next pandemic. And, we and Microsoft are getting ready for it. And I know others in the scientific research community believe it's going to come sooner than the next 100 years. And a lot of what we've learned, I guess, thankfully from this particular pandemic is how to deal with it, and how to quickly mobilize. I mean, being a part of industry right now has been an honor, actually. Without industry, these vaccines would have never been developed as quickly as they have been. And the amount of dedication and scientific resource and just unbelievable energy and thinking and commitment that's gone on from across the industry around the world has been remarkable to see. So
Yeah.
I think, for better or for worse, we'll be more prepared the next time.
Right, right. And how surprised are you about the speed with which these vaccines have become available compared to the typical timeline for a vaccine?
Yeah, I think it's remarkable. I was not anticipating it to actually be so clear cut in such a short period of time, just because it's a world record we've never seen. But again, the data is so clear and the trials were run so well and everything was blinded and done appropriately, and thought of everything they could think of in advance in such a short period of time. It shows us the power of where we're at with research today, and what the future of medicine could hold.
Yep, truly extraordinary. All right, so I've got another question here in the chat box. How does immunity from the vaccine differ from immunity following being infected with the coronavirus?
Yeah, so that's a really great question. There's actually about 11 parts of the SARS-CoV-2 virus, 11 genes, call it, that the immune system sees. And you're probably all familiar with the one that's talked about the most in the news, which is the spike protein. So the majority of the vaccines are directed specifically at the spike protein, whereas when you get the virus, the immune system reacts to all 11 parts of the virus that it sees. So the immune response will vary a little bit between the natural infection and the quote unquote sort of infection you get from the vaccine. We don't know the impact that will have on immunity yet. That is something that we are actually involved in trying to understand. Is there a difference between immunity from the natural infection versus the vaccine? And we're actually running some studies where we are actually receiving this month samples in our lab to be able to compare that. So we're looking at samples from people in the placebo arm of the trials, some of these vaccine trials, people in the vaccine arm, and then of those who did and did not go on to get the virus. And then we, of course, have plenty of samples in our lab that we've already sequenced looking at the immune response to the natural infection. So we should, in short order, have a lot more of that information where we can really understand the differences in the immune response and then track longitudinally those patients over time to see if there's any difference in immunity. So we don't know yet. But what I've been told so far is, and from the data that's publicly available from the Pfizer filing, and I'm sure will be publicly available soon from the Moderna filing, is, they did do a variety of different studies to assess the strength of the immune response to the vaccine, and it looks very, very promising. We just obviously don't know how long it lasts yet because they haven't been around long enough to monitor the persistence.
Right, right. Okay. Next question we have. Will the work you are doing with T cells help identify the emergence of new pathogens?
So that's a great question. We can see all the T cells in a blood sample, and we over time are going to be able to map them to any pathogen. So we aren't using the technology today to look for new pathogens, but if there were a new pathogen that we never saw, when we get really good and the map is complete, we would by definition know that there was something new if it wasn't in our map. But we're not there yet. Right now, what we're looking at is we're starting with the pathogens themselves, and then identifying all of the T cell receptors that the immune system across all HLA types, which most of you are familiar with. What makes the T cell response so complicated is that it's HLA dependent, and there's so many different kinds of, there's so many different HLA types around the world. And to have a T cell signature of a pathogen, you've got to take into account all ethnicities and all of the various HLA types around the world. And before Adaptive's technology, that wasn't possible before. So that's why this is the first time where we can really have a molecular technology that allows us to take into account the enormous diversity of HLA types and therefore T cells. There are trillions of T cells in the world, and there are millions in each and every one of us, and they're different between all of us. So it's a very large problem to solve. But once it's solved, then yes, we should be able to see if there are new pathogens emerging in someone's blood, but we're sort of starting the other way around.
Right, right. Yeah, and you're talking about diversity, and it's something that we focus on tremendously at Gift of Life as a donor registry, like all the registries around the world, is increasing diversity so that every patient out there can have an equal opportunity to benefit from the treatment that can save their lives.
That's right, and that's why for us too, it's so important that patients from every background participate in this type of research and participate in donations, blood donations and any trials that are available that can help, sort of solve that diversity, simplify the complexity of the immune system is really important, because ultimately it's going to help so many more people.
Okay, wonderful, wonderful. So actually, as we're going through here, I got a note that one of our transplant recipients from Boston, who's here in Florida right now, Evie Goldfine, just shared in the chat that she gave $10,000 towards One Huge Day. So I just wanted to give a shout out to Evie, who's watching right now. Thank you for paying it forward. And so far, she through her donations and her donor circle have saved 104 lives and counting. So thank you, Evie. That is awesome. That is awesome. All right, so we're going to take another question or two here. The next question, let me see here. Okay, so I somehow I think that this question might have come from someone in our office here. So the question is, Gift of Life's new Center for Cell and Gene Therapy will allow us to provide starting material to researchers in a number of fields, including immunotherapy and regenerative medicine. What are some of the most exciting research developments that are coming, if that's something that you're able to address?
Sure. So I'm really excited about the work you guys are doing. And in fact, we've connected some of our scientists at Adaptive to Jay and some of the people working in the new Center for Cell and Gene Therapy at the Gift of Life. I think what I'm most excited about, again, because I'm a big believer in the power of T cells, is to be able to use T cells as therapies. And what is so powerful about that, initially for cancer patients, we'll start with, so everybody's, let me just back up for a minute. Everybody's tumor is made up of a set of mutations. Some of them are shared between patients, and many of them are specific to that individual patient. And the T cells in a person's body sees all of those mutations, those that are shared and those that are personal, or what we call neoantigens. And so what we're doing with Genentech, which I think we're most excited about, is we're starting with T cell receptors that are shared amongst patients to really get to understand how to engineer T cell receptors into therapeutics. But what's so promising down the road is that we should be able to pull out the mutations from each patient's unique cancer and identify the set of T cell receptors from that person alone and pick out the ones that are the strongest and then engineer those to reinfuse those right back for that patient. So the idea of being able to do a personalized cell therapy is really remarkable. It's years away. It's not in the very near future, but it does give us the hope of solving the sort of N of one, which is really what each cancer patient is. And that is, to me, incredibly promising for the future.
Right, right. Okay, that's wonderful. Well, I think that's about the amount of time that we have for Q&A. There are a couple of other questions, but we will answer those through email. Let me just thank you, Julie, for taking the time to join us today and share your exciting work. This has been phenomenal and particularly exciting for me, especially given your close connection to Gift of Life, and we really appreciate your support. So. Thank you so much.
Sure, of course. And thanks so much. And thanks for having me, and good luck today, and congratulations on all of your success.
Thank you. Thank you. Let me just remind everybody that today is one huge day. We're grateful to our generous matching gift donors whose contributions will be matched dollar for dollar up to $100,000. The last update that I received, there it is 141,703. That's awesome. That's awesome. So we're only about $60,000 away from achieving our goal of $200,000, and it's because of people like you. You can help save Sloan and patients like her who are in urgent need of their miracle matches. Please encourage your family and friends to donate today at giftoflife.org/onehugeday. So thank you all for joining us here today, and best wishes for a happy, healthy, and most important, a safe holiday season. Take care. Thank you.